So, hi everyone, today's topic is assessment of nutritional status. Coming to the introduction, health and nutritional status of an individual depends on the food he eats. So, how do you find whether the individual is in a state of good nutrition or not? Okay, so it's like first thing, no, appraisal of the individual according to the science could be the way of assessing of nutritional status. So what are the other ways of finding the nutritional status? So collecting the food diet, or doing a food survey. So what he is eating and all, no, by collecting that kind of information also you can understand the nutritional status of the person, like by signs and symptoms. Okay, means like you want to, by clinical features, like for example by seeing the child itself, you can see whether the child is malnourished, if he is having the protein energy malnutrition, if he is having the marasmus, or if he is having kwashiorkor, or if he is having iron deficiency, or if he is having a vitamin A deficiency, by looking at the signs and symptoms of that person. For example, in iron deficiency, you can see there is a spoon shaped nails, and the skin is pale, and the eyes are pale, the tongue is pale. So all these signs and symptoms, by seeing this, what you can do, you can understand the clinical condition. According to that, you will understand what deficiency is causing that clinical condition, and then by this way you are going to assess the nutritional status of that person. And then also you can do the biochemical methods, like, okay, in that you do different types of biochemical test, like for example you need to know the hemoglobin, whether the patient is taking the iron supplement correctly or not, if he is having sufficient iron or not. For that purpose, what you will do, you'll ask the patient to go for a HP check. So hemoglobin, it is less than 12 in 12 to 14 is normal range, so less than that is like low hemoglobin levels, right? In the same way you will do an urine analysis to check the thiamine levels. Like that, there are different tests to be done, so that you will understand that the person is having the nutrition level, the level of nutrition in him. Like doing the calcium test, blood serum level, blood calcium level, like this there are so many biochemical tests, right? So that is also one way how you can assess the nutrition status of that person. After the test, you can make the person to understand that he is having so and so deficiency, and he have to take so and so food for curing that deficiency. So all these are and also something, you can measure the height and weight of the child according to the age, whether the weight of the child is correct or not. All these things matters. So by that also you will understand whether the child is malnourished or moderately nourished or healthy. All these things you can understand by checking the height, weight, and by checking the circumference of head, checking the circumference of chest, checking the circumference of arm circumference. Like this, there are so many things, and there are things like height to weight ratio. All these things, you can understand and assess the nutritional status of that patient. So methods of assessing the nutritional status. What is nutritional status? It is a state of health of an individual as it is affected by the intake and utilization of nutrients. So what you will understand by this definition is that the evaluation of nutrition intake alone can help judge the nutrition status of an individual. So let us make it simple. For example, if you consider a child who is not growing adequately, the child failure to achieve an adequate rate of growth, for instance, may be caused due to hereditary factors, infections, other diseases, dietary lack, or any other factors. Okay, hence evaluating the food intake alone may not be sufficient for the evidence of judging the nutritional status. So there are so many things like what I told you before. So let us go into deep discussion of this. Like then coming to what how you will there are four major methods used to assess the nutritional status of an individual and population groups, which include, there are four methods, right? One is anthropometric method, measurement, clinical method, biochemical analysis, and diet survey. What is anthropometric measure? In anthropometric measure, again there are four common used simple body measurements to understand the nutritional status, which are good indicators of nutritional status. One is weight for age, the other is height for age, next one is arm circumference for age, and then the weight for height. So what is like first let's go with the height for age. So length or height, it affects the total increase in size of the individual up to the moment it is determined. For example, we know that normally a baby measures, a baby measures around 50 centimeters at birth, but the length will increase to 75 centimeters at 1 year of age. By the age of 4 years, he'll increase the height to 100 centimeters. Then for 1 year, again for each year increasingly 5 centimeters is keep on increasing until the age of 10 years. So recording the height would therefore helps us to know whether the child is growing normally and is in a good health or not. Okay. Then height does not decrease and therefore cannot be indicative of deterioration in health. Height for age therefore is only a measure of long duration malnutrition. And then if there is a low height for age, then it is indicative of stunting or chronic malnutrition. Okay, and this is how you check the height. One thing, you can use a normal tape to measure the height, and the other thing is like for babies it is mentioned as length. Okay, you will measure with a measuring scale and also called as infantometer. Okay, coming to weight for age. Weight for age is commonly used indicator of body size and it reflects the level of the food intake. So weight for age is a very sensitive measure of short duration malnutrition. The weight recorded can be compared with the standard values of, alternatively of the weight can be plotted against the graph. That means one side you have to, in a graph you have to make something like normal weight for that age, and whatever the weight of age you have recorded, you have to plot it on the graph. So low weight for age is called underweight. So this is the three methods of like your weight, doing a, have to measure the weight. One is the first one showing it is the beam balance. So it's like a normal platform scale. Then Salter scales. The other one is the Salter scale can be hung from a roof or a tree as shown in the figure. Okay, the child is placed in the sling and then the weight is recorded. The third one is a normal regular measuring weight. How we do normal weighing balance. Here what you do, you ask a mother to carry the baby. Along with the baby, first she will measure the weight. First she will measure the weight of her along with her baby. And then after what she'll do, she put the baby down and only she will check her weight. So the weight with baby minus the weight of her is equal to the baby's weight. But since it's not so accurate, but this is also one of the method how you measure the weight. Coming to the next topic, weight for height. By relating the weight of a child to its height on length, an objective measure for the child degree of thinness can be obtained. So by weight for height, what you will understand the thinness of the child. Okay. Then weight for height basically is a very good index for short duration malnutrition. A low weight for height is called wasting. This is very important. And then, it doesn't depend on age factor. Only thing is according to the height, what is the weight of the child? Or according to the weight, what should be the height of the child? Okay, like this it is. It doesn't depend on the age. And then let's move to mid-arm circumference. Okay. So coming to mid-upper arm circumference, also called as MUAC. So what happens? The arm circumference, you might be aware, basically it includes, what includes in that arm? Bone, fat and muscle. So for example, if there is a reduction in that, you will understand whether that patient is having the child is having protein energy malnutrition. Based on the reduced arm circumference, you are going to decide that. Okay, so arm circumference normally increase with age, but between 1 to 5 years it doesn't need the circumference is constant at the age of 1 to 5 years. So at this time, the baby fat is replaced with muscle. Measuring the arm circumference of this age group would therefore give a good idea whether the child is good health or not. So mid-arm circumference of age group for the Indian child, for example, if it is less than 12.5 centimeter, it indicates the child is having severe malnutrition. And if it is like between 12.5 to 13.5 centimeters, then the child is having moderate malnutrition. If it is like between from 14 to 15, then the child is healthy. So how you are going to measure it? You're going to measure it by normal tape. If you are measuring in the home, you use normal tape for that. Okay. If you are measuring it in the field, a tricolor arm tape is used. So how it is used? Let's see. For example, if the red end comes opposite to the green, it indicates the child is normal and healthy. So which part of the arm you are taking for the measurement? Middle part of the arm is taken for the measurement. So if the red comes in opposite with the green, it is normal and healthy. If the red comes opposite with yellow, it indicates that moderately malnourished. Okay. So he requires extra 300 kilocalories of energy and 8 to 10 grams of protein. Okay. Then he have to be monitored regularly. And then if the red end of the strip comes in contact with the red, then it shows that the child is severely malnourished. So the child needs more food, and he have to be feeded supplementary food like at least 5 to 6 times a day. He should be feeded, and weight should be checked every month. And also you have to take the doctor advice, because there is chances of death because of the severe malnourishment. Okay. So coming to other anthropometric measures, there is two things. One is head circumference, other is the chest circumference. The head circumference increase rapidly during the first 6 months of birth, and whereas the chest circumference, it is, you can only check it out in the second and third years of life. Okay. So these are also other anthropometric measures. So till here we have discussed the anthropometric measures, clinical methods, biochemical methods, and food survey. I'll discuss in part 2 of this. Thank you.